Mari McInerney from Croaky here at the ASMET 2024 conference in Darwin on Larrakia country, and I'm here with Steve Lacey. Steve, could you introduce yourself and what work you do?
Yeah, so my name's Steve. I'm a radiographer currently working at the Royal Children's Hospital, although about to actually move across to ASMET to work for them as their Director of Education.
In Melbourne this is?
In Melbourne, yeah. I think also I work as a allied health clinical educator with the Royal Children's Hospital outreach team as well.
Okay, and on that, in that capacity, you're actually presenting here?
Yeah.
What's that on?
Yeah, so we have a couple of podcast shows which I do a little bit of hosting for. So we're just running, the presentation's basically just going to be about my experiences as a podcaster. And
what are your experiences as a podcaster? Can you say what the podcasts are, and then what are the key messages, do's and don'ts?
Yeah, so the two podcasts are, one of them that we have is one called Teach, Think, Treat. So this all comes out of the Royal Children's Hospital Education Hub. So one's called Teach, Think, Treat, which is all about clinical education and information clinical placement for students. And the other one that we have is what we call Conversation with the Experts, which is where we talk to specific healthcare experts about different clinical topics related to paediatric healthcare.
What's one of your favourite episodes?
Oh God, that's a good question. We did a series on clinical placement for students, so just what the expectations of a student might be, what the expectations of a clinical educator might be, how to best prepare for them as well.
And what's behind you presenting on this here? Do you think it's the way of the future for communicating, or avoid at all costs? Or?
Well, I don't know if it's the way of the future, but it's certainly the current situation. I think the way that it is. I think it is a relatively new thing that's been happening as far as education for people is concerned, because of the way that it can be easily tailored to people's needs, and you can listen to it for as long or as little as you like, and I think that's been quite useful for them. So whether it's the future, I don't really know, but at the moment it seems to be working as an adjunct, I think, to the other learning methods that they can have.
Mm-hmm. And are there any don't do's that you've learned, or really good do's?
Probably the big one is just like investing the time. I think don't rush it or anything like that, and try. I guess probably the biggest don't do as well is just don't read from a script, because I think it becomes very obvious when you're reading from a script compared to when you're just expressing your thoughts. Yeah.
Now you're also presenting on other things.
Yep.
What are they?
So another one that I'm presenting on, I'm actually presenting with one of my colleagues at the Royal Children's Hospital, Judith Reed. We're going to be presenting on the Paediatric Academy, which is an online community practice tool that we have. And then the other one I'm doing is I'm representing the International Society for Radiographers and Radiologic Technologists as their Director of Education, and I'm going to be just talking about who the society is and what they do.
And can you tell us that? Who are they? And
we kind of represent radiographers and radiation therapists across globally. So we're representing more than 500,000 of them, generally through the member societies, and we also provide different kind of techniques and talk about education as well, and disseminate that education out through the member societies, and we develop different training curriculum. And
top 3 issues for the profession internationally?
Global shortage is probably the major one at the moment, I think. I think another issue is just a global identity, professional identity that we have as a profession ourselves, but also just a quality of healthcare for everyone around the world.
And why is that an issue? Is it access to technology? And
I think access to technology. I think access to just to money. I think there's because money is not equal around the world. I think that means that people just don't put money in towards healthcare or anything like that. But I think one of the biggest issues that we need to tackle is probably more just the education of radiographers and radiologic technologists around the world, because there's no equity with that. It's not universal. It's kind of very much country dependent as well.
And when you talk about the profile of the profession, what's the problem? You don't have a strong profile in the
professional identity. Yeah. It's probably because one is because of the education that is needed in order to get to the point that radiographers need to be at. but I think also because the scope of practice is quite variable depending upon whether you're in one country or another.
And that needs to become more uniform?
I don't know if it needs to be. I think it just needs to be more recognised that it is, and that because it really, it kind of, I guess it tarnishes, I think, what a radiographer can do, and the identity is really, really important to make sure that we are recognised globally as a professional body as well.
And anything in particular you're looking forward to here, besides your own presentations, to give them?
Oh, look, at the moment we're in the middle of a workshop at the moment on clinical education, which has been developed by a bunch of clinical educators, including myself, but it's been headed up by Kat O'Keefe from Queensland, who's done a brilliant job in putting it all together. But I think it's more just, re-establishing those connections and making those networks with more radiographers and radiation therapists around the country.
And just coming back to the international angle, is Gaza on your horizons at all?
We tend to steer clear of political, with the ISRRT, we tend to steer clear of the political aspects of it, only because if we have one stance towards one path within war, then it means that we have issues. We may have issues from the other side, and we certainly don't want to kind of tarnish the relationships that have already been built. So we will support and provide aid where we can with the expertise in that, but we're much more of an educational body rather than actually providing. There are other organisations that do provide personnel to be able to kind of go in there and actually work, and that's not what we do. We kind of provide the education more than anything else.
Okay, that's fantastic. Thanks very much.
No worries.